METADICHOL improves skin sensitivity and skin inflammation by inhibit the inflammatory factors. METADICHOL will bind to vitamin D receptors and help strengthen immune function by increasing vitamin C levels in the body to achieve anti-inflammatory, antibacterial, and anti-allergy effects. Furthermore, METADICHOL increases metallothionein, protects skin from oxidation and aging, prevent damages from heavy metals and UV rays, and also prevents keratosis. METADICHOL regulates the levels of cathelicidin and defensin to achieve anti-inflammatory and antibacterial effects, promotes wound healing, prevents skin inflammation, sensitivity, and itching. At the same time, METADICHOL increases pluripotent stem cells to promote cell regeneration and repairs damaged skin. Besides that, METADICHOL improves over 3,000 skin conditions including allergies, eczema, acne, diabetic wounds, psoriasis, lupus, viral and bacterial infections. Moreover, METADICHOL improves psoriasis. 3% of the world's population suffers from psoriasis. Psoriasis is an immune-mediated inflammatory skin disease characterized by hyperproliferation of keratinocytes. Psoriasis can appear on the scalp, ears, elbows, finger joints, back, and knees. Symptoms of psoriasis include pink or red patches, silvery white scaly skin on the surface of the patches inflamed, itchy or painful skin, redness and peeling of the scalp, or spread all over the body or even form pustules. In addition, METADICHOL inhibits some substances that cause overgrowth of keratinocytes. At the same time, METADICHOL binds to vitamin D receptors, increases metallothionein, and has strong antioxidant activity that can inhibit excessive proliferation of epidermal cells. It can also regulate immune system, thereby reduces skin damages and prevent abnormal skin cells differentiation. METADICHOL improves systemic lupus erythematosus. Systemic lupus erythematosus is an autoimmune disease of unknown etiology that causes erythematous lesions on multiple parts of the body. Erythema can appear on the face, ears, shoulders, chest, and hands. Most of the patients are sensitive to the sun, which causes skin erythema often becomes severe after exposure. METADICHOL will regulate the immune system by binding to vitamin D receptors, prevent immune disorder from attacking the skin tissues. Besides that, METADICHOL regulates the differentiation and functional activity of T and B cells, inhibits the production of autoantibodies, and reduces inflammation. Patients with systemic lupus erythematosus suffer from severe oxidative stress and systemic vasculitis, in which the permeability of blood vessels increases and causes inflammation to occur. Therefore, vitamin C supplementation is needed to improve the condition. At the same time, METADICHOL increases vitamin C levels in the body. It has anti-inflammatory, antibacterial, and antioxidant effects, can help to regulate immune system and reduce inflammation. Simultaneously, METADICHOL can also reduce inflammation caused by bacterial and viral infections. The infection of reproductive organs is a big impact to body health. If the infection left untreated, it will not only lead to infertility, but may also permanently damage our vital organs, such as the heart and brain, eventually lead to death. METADICHOL can regulate our immune system to kill viruses, bacteria, fungi, mold, and reduces infection, inflammation, itchiness, and unpleasant odors. Therefore, METADICHOL is effective against cervicitis, vaginal infection, endometritis, syphilis, and genital herpes. Finally, as for the direction of usage for healthcare, take at least 10 sprays, at least 8 times daily, for the first bottle. Second bottle onwards, take at least 5 sprays, at least twice daily. In addition, people with underlying health problems can take at least 10 sprays, at least 8 times daily for the first bottle. Second bottle onwards, take at least 10 sprays, at least 5 times daily. That's it for now. Thanks for watching, and have a great day.